quick question that I get asked is, do I need a root canal, or when do I need a root canal, or what would make me need a root canal? Well, there are a couple of different answers to that, so let's look into that. First, if you have a cavity that is deep enough that the bacteria have penetrated the nerve of the tooth and infected it, that's a reason to have a root canal done, because you can't simply put a filling in the area. The tooth will flare up and be very uncomfortable, or it will die and cause an infection. Which leads us to the second reason that people can need a root canal. A nerve in a tooth could have died, and that can sometimes be very quietly over a long period of time, or very suddenly, in which case you're really aware of it because it's quite uncomfortable. But when the nerve in the tooth dies, it can get infected, and then that will show up on an x-ray, or you may notice a swelling on your gum or in your face. When you have that happen, that means that the nerve is dead, and the tooth can either be removed, or you can attempt to salvage the tooth with a root canal treatment. What's another reason for a root canal? Well, if you take a fall and you break a tooth and the nerve in the tooth is exposed, more than likely that tooth is going to require a root canal. So traumatic injuries, cavities, and bacterial infections are the three major reasons that people need root canals. Occasionally, the fourth reason for someone needing a root canal would be if they need to have some dental treatment done on a tooth that's not in a proper position, and putting that tooth into the proper position would encroach upon the nerve space. That would be the fourth reason that someone would need a root canal. But generally speaking, it's usually a cavity, an injury, or an infection.